Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate. Another lecture from my series MRCS Examiner Advice, and this series is freely available on YouTube. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and examiner of the Royal College of Surgeons of England. Now, the topic I'm going to speak on today is rather interesting. Can AI predict which OSCE station in particular for MRCS Part B examination? As you know, AI is a large language model and it depends on the amount of data it can search for, and it can diagnose a pattern and give you prediction. So you can have a prompt which is the way you ask artificial intelligence. And I have selected the prompt with a lot of technology inside the frame, how you put the prompt. And we are going to pass this prompt on AI for MRCS Part B. We're going to use Gemini, and this is by Google. We're going to use Manas from China, DeepSeek from China, because China sometimes have much deeper parameters in search wise. And we're going to use one of my favorite, which is Perplexity. And we're going to use also ChatGPT. And lastly, Vasai. Vasai is an AI which I have created to help me in MRCS teaching and also in vascular surgery teaching. But this is very, very specific for MRCS, and maybe the answer will be a little bit dangerous. So I wouldn't use it. But I want to tell you some few points first. Number one, no one can predict which station will come in the exam. And this is a fact. The examination team is so professional that even the examiner only knows the station exactly on the day, not before, just on the day. By the time candidates are being enrolled for briefing and their mobile has been taken out, this is the time that we know which station we will be judged and examining on. So if anyone tell you that he will know which station will come on the next day, is definitely not true. Not the examiner, not the staff, no anyone. So this, and I'm very proud of the confidentiality of the Royal College, or the grade or the website, and this is controlled by ICBSE, which the president is Professor Amr Mohsen, a very eminent orthopedic surgeon in United Kingdom, and he's in charge of the Intercollegiate Basic Surgical Exam ICBSE, which make the exam for all the stations. Number two, even if you know which station you will be examined on, you still can fail. And I have seen this multiple times. You can know which station you will be examined, you still underperform, especially in communication skills, especially in history. So I've seen this time and time again. Unless you really are well prepared for the exam, you will not be able to pass the exam, even if you know which station will come. And this is a fact I know by heart, because I did give a lot of courses for MRCS candidate. Now, the prompt I have used is very professional prompt, not easy for you to do it, but I will say to the AI, can you give me an educated guess on which OSCE station will come in November, Cairo exam, Royal College of Surgeons of England, MRCS Part B exam, and search all information on previous MRCS Part B exam. Give me an educated guess which station is likely to come and how to prepare myself for it. So let us pass this prompt on these AI and see what is the reply. So here is Gemini, and then I will put here the prompt that I have created. Okay, and then we can go, and this is a reasoning model which will understand what I meant, and then we'll do the search. Gemini is one of the greatest and very quick search engine, and then we will see the reply together. This is the first AI, which is Gemini. While it is impossible to predict the exact station that will appear in November exam part B, that is good, I totally agree with that. I can certainly provide an educated guess based on recurrent theme of a high yield frequently observed past exam. This is very nice. I can give you an educated guess. So MRCS is designed to comprehensive assess surgical knowledge. So the exam typically consists of 17 stations divided 2 main domain, applied knowledge 8 and applied skills 9 to pass the math. Okay, this is good information. Educational guess, this is what we're looking for. Based on analysis of previous exam experience and recall, certain topics and the station format tend to appear to their fundamental importance of surgical practice. So, start now to tell you what is important. Surgical anatomy, abdominal anatomy, because it's important for surgeon, head and neck, limb anatomy, spine with skull, then surgical pathology. He put common malignancy, malignant melanoma, colon polyp, familial adenomatous bulbi, genetic extraintestinal, all are very important topics to read. Vascular pathology. Someone will say, well, this is all the station. No, this is really focused station. And these stations come very frequently in the last years. Again, ATLS course, ATLS language, scenario is important, physiology, fluid management, applied skills like how to examine the abdomen, lump examination, joint examination, systemic examination, history taking is likely, acute presentation, and the chronic complex issue, procedure skills, knot tying, very common station, basic skills procedure like IV drip, airway, local anesthesia, communication skills, extremely important, topic, interprofessional communication, seeking preoperative advice in ICU, breaking bad news, consent, and capacity. All these are very important topics. Now here is very nice how to prepare for the station. So master course syllabus, and this is we go to the syllabus MRCS, utilize recall strategy, which mean you can share your information with other colleagues through groups by Telegram and WhatsApp, and you can share knowledge and see a lot of teaching videos. Practice, practice, practice is very important. This is my advice to improve your clinical skills is practice, practice. Also procedure skills, you need to practice. History taking, again, you need to practice. Time management, very crucial to know time, how you manage time efficiently, 6 minutes. And leverage resources, here are very nice resources at the end. And by focusing this high yield area, adopting rigorous practice strategy, I think he did give us a good advice. And these are the sources that he was able to get information from. I will give this thumb up so they know that this is a great answer. So let us go to second AI. Now this is DeepSeek. And this DeepSeek, I have able to get an access to the server of DeepSeek straight away in China. and it can have the R1 deep thinking model. So here is the prompt, and let's us fire it to DeepSeek. DeepSeek might have better information in getting MRCS information because it can access Telegram group. So educational guess to MRCS, to make an educational prediction, I have analyzed. You can see he done analysis of the core curriculum, recent OSCE station, and he concentrated on Cairo exam as well. And now he will give us, and this one I told you, the Gemini is just broad advice. But here, it's really focused, especially the R1 model of DeepSeek. Now, clinical examination, he say 3 or 4 station. He put abdominal examination, breast or thyroid. By the way, breast doesn't come anymore. We don't get clinical examination of breast for obvious reasons. Now, vascular exam, very important. Trauma orthopedic, very important. Communication skills. He did put you 4 topics that you should read. Breaking bad news, consent for surgery, dealing with angry relative, ward safety scenario. All very important. Anatomy. He did give you anatomy of inguinal hernia, femoral triangle, bile duct, suturing, so on. Critical scenario. Radiology, X-ray, histology style. Wild card. Less predictable but possible. So now he did give you classification, what is common to come and what is less common. Like pediatric scenario is less common. Plastic open is less common. Simulated procedure like chest drain, it can come. Chest drain, clinical OSCE station, which is a beautiful station. How to confirm and prepare. Now, check recent exam report. So sometime you can go to Telegram groups and you can know which station coming into the exam. You just know the name, but you cannot know the detail. Telegram group, use Facebook groups as well, and this is what to search. And then study high yield topics, and this is clinical examination. And you do mock OSCE practice, and this is what we do in VA Academy. We have a mock exam, which really give you very good practice how to handle OSCE station. And recommended resources, he recommend this book to read. Final tips for success, which is fantastic. And I would give this thumb up from DeepSeek. And I can have, he thanking me for this feedback, because this feedback will help the model to be trained. So I will switch now into Hanium. Hanium is another advanced model, more advanced than Manas. And here we'll see what it will bring, because Hanium is trained on 11 billion parameters. Here are detailed evidence of base. So most probably, and you can see it did put the future November exam. Again, I think it is similar to the DeepSeek. Anatomy, maybe more specific. It did put clinical scenario, ATLS course, postoperative complication, anastomotic leak is important, evidence-based prediction, and Cairo specific trend. He actually analyzed what station comes in Cairo and how common it is. And this is the beauty. So there is increased focus on trauma scenario, which come 3 out of 4 in recent exam. So this is very nice analysis. More communication station than London setting. It's true, there is more communication skills in Cairo compared to London. Higher frequency of basic surgical skills assessment. Recent exam feedback, which in July. Now this Gemini will not be able to do, because as I told you, the amount of huge parameter, it can go inside and tell you what has happened in July 2025, which is just this month. There was abdominal exam, one breast exam with counseling, consent scenario, ATLS. Notice it is not true that there wasn't any breast exam. So the way of verification again is not 100%, but this one did not come. Now, preparation strategy. Now, this is another how to prepare. You need to practice how to do examination. You need to master examine counsel, review your vascular exam sequence. You better improve your complication. You must memorize the spikes protocol for breaking bad news. You must know practice consent discussion with space approach, role play difficult. All these are very important. SBAR also is very important. Anatomical skills, critical care, ATLS is very important. And here are the resources. And this is the final recommendation. Again, it's a beauty. And I would thank them because this is a great reply and he's thanking me. And thank you very much. Let us go to perplexity. Now here is perplexity. Perplexity is one of my favorite. And let us put the prompt again. And let us fire the prompt. And you see now he is analyzing. And let us take, because perplexity is one of my favorite. MRCS Part B, what to expect and how to prepare yourself. Direct question, direct. Exam overdrive. He explained here the exam, how many stations, blah, blah, blah. Applied knowledge skills, pattern of recurring station. While Royal College does not publicize each exam exact content, extensive candidate reports, examiner testimony, preparation course material indicate recurring theme both in Cairo, international venue. So, knowledge station, he said anatomy, 3 station, and he tell you that anatomy is important, surgical pathology is important, 10 skills. Again, he put emphasis on abdomen, vascular trauma, hernia. If you notice this, same as before, and station frequently repeated. Now, this is nice analysis because these stations are frequently repeated. You should learn them by heart. Abdominal examination, neck lump, thyroid, vascular exam, fracture management, consent appendectomy, breaking bad news, suture technique, interpretate X-ray and CT angiogram. Some test or pilot station can be included, but not assist. That's true, but this doesn't make a difference. Educational guess for November. So this is an educational guess by perplexity. So they think that it will come thyroid, neck, vascular limb examination, consent, basic and applied anatomy, often model and specimen, interpretation of trauma, abdominal radiology is important, wound care scenario. So preparation strategy, you should content master, you should master all the anatomy area with clinical significance. Skills practice, you need to practice suture, practice simulation, practice communication skills. Mock exam, as we have mentioned in the VA Academy, we run a mock exam nearly every month. Time management, very important because a lot of candidates doesn't know what is 9-minute means or 6-minute means. So they become very slow and then they stop in the middle of the exam because they can't finish. Build a study plan, clear station types, and here he put example that may appear. So he put user station, communication, consent of surgery, breaking bad news, anatomy. Very nice. Further tip, review recent candidate report to get some information. And related based on MRCS pattern, which station likely in November. Here are some related researches that some people can use and can benefit. So So here we have done Gemini, we have done Manas, and DeepSeek, and we have done Perplexity. Now we are going to do ChatGPT, but Vasai is dangerous because Vasai is very, very specific and give you really fantastic result. And the way I have done it, I have limited the data entry only from reliable sources and only focus on MRCS and vascular surgery. So this one I wouldn't use, but let us go to ChatGPT. So here is the ChatGPT, and let us put the prompt again, same prompt, and let us see the answer. Okay, here is an updated data informed educational guess. What can come in November in Part B? Official exam blueprint, 17 station. Okay. What is likely? Now, ChatGPT went directly into what is likely to come. He thinks that anatomy will come brachial plexus, inguinal canal, popliteal fossa. Very specific. Pathology, applied science, sepsis, ABG, ECG, communication skills. 2, clinical exam. 4, history taking. It is pretty accurate, really. But what is the evidence? No evidence, just he predicted a pattern. Procedure skills. Why these are likely? He answers the question, why they are likely? Cairo uses the same intercollegiate blueprint for UK Center. That's true, because all are controlled by ICBSE. Serial media support group like Cairo exam consistently highlight these type. While private, the team align with international pattern because he did go to Facebook groups related to MRCS and he read the feedback. Global candidate feedback UK centers as well. How to prepare effectively? Usually he gives you advice. Anatomy, use Ackland Anatomy, very nice book. Critical care, you must know everything about ABG, ventilation settings, sepsis protocol, communication consent, history taking, examination also, procedure skills for suturing, chest drain demo, and mock circuit. Again, to be trained on mock exam is very important. Now, example of mini mock station, chest drain. Now he give you an example. I didn't ask him for that, but he give an example of a chest drain station. Final thought, this station is guarantee, but align closely with what Cairo historically delivered, what MRCS blueprint mandate. So he think that this station is important. Again, as I said, no one knows what will come into the exam, but you can know what is important that you need to know by heart, but you must study all stations. So now we have done a ChatGPT, and now we're going back, and this is a question that we originally started with. Can AI predict? Then I would answer this as yes. It can predict, and it's a good tool to prepare yourself for the exam. But you can know the station, but if you don't know how to perform it well, you still fail, and no one knows what station will come into the exam. This is just an artificial intelligence educated guess. And I hope this lecture is of benefit to MRCS candidates all over the world. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and examiner of the Royal College of Surgeons of England. And thank you very much. I wish you all the best.